everyone. This is Lisa, your favorite spoon bunny, and welcome back to the Life Spoontastic. I will apologize in advance if I look just a little dead. This is day 2 of possibly one of the ugliest flares that I have had in quite some time. I woke up yesterday to feeling like my arms, legs, hands, feet, neck, and back were all being crushed under the weight of a bus. And that did not subside until late yesterday evening, and I spent a lot of yesterday sleeping. Today I woke up to having both arms burning and the rest of it still being the crushing sensation. I will do my best to finish part 3 of understanding the chronic pain patient. And part 3 is what I feel is probably the most important part. Knowing what to say. Number 1. Leave your pep talk for your kids and your gym buddies, please. Realize that chronic pain is variable. Case in point, yesterday and today for me have been absolutely horrible by comparison to the last couple of weeks. And a pep talk can be aggravating and demoralizing to a chronic pain sufferer. If you want a chronic pain sufferer to do something, then ask if they can and respect their answer. You know, my dear friend Vanessa came into my bedroom yesterday morning, and that was when I felt like almost my entire body was being crushed underneath the weight of a bus, as I said. And she asked if there was anything that she could do for me, if there was anything that I needed. And she proceeded to try and massage my ankle. Well, that gentle touch that she gave me, and I know it was gentle because she wouldn't have done otherwise, the gentle touch that she gave me felt like she was trying to break my ankle. And so I proceeded to, unfortunately, sort of yell at her to not touch me, and, you know, sort of, I kind of threw her out of my room, and I really felt bad about it, and I apologize later for it, you know. But, you know, when you want us to do something, or if you ask us if there's something that you can do for us when we're at our worst, because it's variable, it's absolutely variable. Ask us if it's possible. And if it's not, respect that answer, please. Try not to say, but you did it before. or, come on, I know you can do it. And I know that's meant to be encouraging, but it's a double-edged sword is what it is. It's meant to be encouraging, but it ends up being hurtful instead. Staying as active as possible and participating in activities like walking, bicycling, Tai Chi, those things might help ease some muscle and joint pain. Sometimes being a little sedentary causes pain to get worse. Yes. But lecturing us on the value of exercise and fresh air, just don't do it. For a chronic pain sufferer, those things may not help our pain. And sometimes it can even exacerbate it. Telling us that we need to exercise or do something to get our minds off of our pain, that's really, really frustrating. Because, don't you think that if we were, that if we could do something to get our minds off of the pain, don't you think that we would, be pretty gung-ho about doing those things? When the pain is so severe that you can't even think, you can't even hold a thought in your head, you can't even think straight. There's no way to take your mind off of the pain. Unless, of course, you can just go to sleep. Blessed sleep. Another statement that hurts is you just need to push yourself. You need to try harder. Sometimes participating in one activity for a short or a long period of time can cause more damage, can cause more pain for us. And not to mention the recovery time. That can be even more intense. There's no such thing as pushing through the pain for us. For chronic pain patients, there's no such thing as pushing through the pain. There is only pushing into more pain. That's what that is. You're not pushing through the pain. You are pushing into more pain. Keep that in mind. Please. An individual with chronic pain does not need to be told, you're too sensitive. We don't need to be told you have to deal with it better. Or you have to do blah, 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 blah. Hello, of course we're sensitive. You have no clue what we cope with. You have no clue with the amount of pain or worry that we deal with. Number 2, don't play doctor. It was fun when we were kids. It's not fun now. Chronic pain patients are constantly working with doctors, working to improve and to do the right things for their illnesses. You might not give the right advice, especially if you're not medically trained and haven't got a clue what that person is dealing with. Be sensitive when suggesting medicines or alternative treatments. Prescriptions, over-the-counter medicines, and alternative therapies can have side effects and unintended consequences. Believe you me, I have tried not only the prescriptions, I have tried physical therapy, warm water therapy, physical therapy in the pool, in a heated pool. I have tried epidural steroid injections. They don't work. I have tried Toradol trigger point injections. They backfire and put me in hideous amounts of pain for weeks on end. I have tried sympathetic nerve blocks. These can last 2 to, if I'm really lucky, 10 days. I have tried a radio frequency ablation. That's a really fancy way of saying that my doctor put me under general anesthesia and burned the nerves in my lower back in an attempt to kill the tissues, the nerve tissues, so that they couldn't relay the pain signals any further. That procedure put me in a grotesque amount of pain for a solid month. And now is an RSD site. Because now that burn, the burning that he did, still burns. Some days more than others, but it burns, at its worst. I can't even stand to have a t-shirt touch my back. My spinal cord stimulator, another double-edged sword, because my implant site is another RSD site. every time I get a new injury or a new surgery, my RSD spreads to the site of the new injury or the new surgery. That I'll cover in a different video. But my spinal cord stimulator does a good job of kind of covering up some of the pain in my limbs. However, I can't use it for very long because it causes me paresthesia itchies. I get the itchies, the creepy crawlies. But anyway, you know, long story short, many of us have tried a lot of different therapies and a lot of different treatments and a lot of different, you know, things other than drugs. To try and get rid of this. We're not just drug seekers. The unabashed truth is that for some of us, physical therapy and meds are the only things that work. Every other treatment for me, aside from the spinal cord stimulator, has failed. And even the stimulator is sort of 50-50. I have to be careful with it. You know, so be careful when you make suggestions on treatments. Some patients may not appreciate suggestions at all. It's not because they don't want to get well. Trust me. It's just that they may have heard of it or they may have already tried it. You know, some of us have been in this process for years. We try and we fail and we try again, and you know, we just keep going. And my husband's reached the point where anytime my pain management doctor attempts to bring up the idea of a new injection, his face just drops and it's like, we're going to try sticking a needle in you again? Knowing that sticking a needle in you has failed how many times? You know, so, you know, your patient may not be very receptive to your suggestions at all. It's not because they don't want to get well. It's just because they may have tried it already. They may not be ready to cope with a new treatment that can create even more of a burden on an already overburdened life. Treatments that haven't worked they carry emotional pain. The emotional pain of failure, which in and of itself just makes things worse. If there's something that cured or helped people with a particular form of chronic pain, just kind of gauge whether or not they seem that whether or not your patient is receptive. If they're receptive to hearing it, great. If they're ready to hear it, great. Just be sensitive in how you bring it up. Don't, oh my goodness, don't lecture about prescription medicines if they've been prescribed by a doctor. Pain control is hard to manage, and some days the patient may require more pain medicine than others. Tolerance is not addiction. Do I need to say it again? Good. Number 3, we're back to throwaway lines. Don't assume that you know best by making statements such as, well, that's life, you just have to deal with it. Or, you'll get over it eventually. Or, you'll just have to you'll just have to do your best. Or, here's my favorite. Well, you look well enough. These lines are a form of distancing yourself from the patient. More often than not, it just makes the patient feel worse and out of hope. People who live with chronic pain know how they feel. We are well aware of our situation. So just avoid projecting onto the sufferer how you think we should be feeling. Throw us lifelines rather than throwaway lines. Say something more like, how can I help you? Or better yet, Is there something that I can do that would help you with your pain? Number 4, don't compare health problems. Don't say, well, I've had that before and I'm fine now. I'm pretty sure that 99.9% of the population of the United States in a random survey, like if somebody walked up to me on the street, could tell me, well, I had CRPS before and I'm fine now. But no. Somebody that says that just shows a lack of understanding, and it makes the person living with chronic pain feel like a failure. Like they can't handle what they're experiencing, and others would do a much better job in the same situation. Number 5, be positive. It is hideous living with chronic pain. But it's even worse when people give up on you. Or when people misunderstand you. Or when people spread negativity around or about you. Everyday life is hard, and it's very lonely for chronic pain sufferers. Constant support, offering us hope and showing us your love are all crucial to communicate with us. Comfort us. Let us know you're here. A loyal friend is a literal lifesaver. And I am not kidding about that at all. So many lives are lost to the battle with chronic pain, chronic illness, because the illness and the pain just hammered and hammered and hammered and hammered away at the patient so hard and for so long. And they had no one to turn to talk to get help from, to anything. Because they were isolated. The illness and the pain cause them to turn to what I refer to as a permanent solution to a temporary problem: suicide. So, a true friend for a chronic pain patient is literally a lifesaver. Number 6, ask about our treatment. Ask us how satisfied we are with our treatments. It's important to ask us helpful questions about whether your patient thinks their treatments are satisfactory, or if they think their pain is bearable. People don't really ask these open-ended, helpful questions. And those are the questions that might help chronic pain patients open up and really, really talk about it. Number 7, ask us how we're doing. Don't stop and don't stop asking us how we're doing. Just because the answer might be uncomfortable for you, don't stop asking us how we're doing. It may be the only opportunity to show that you care about us. And if you don't like the answer, keep in mind that it's their answer and it's not your opinion. When a patient finally opens up to somebody, they shouldn't be told that they talk about it too much, or that it's all they talk about. Please recognize that their pain is probably a huge part of their lives. They may not want to talk about things like vacations or shopping or sports or gossip, because quite frankly, when your body feels like you've been dropped off the 3rd floor window, you don't really care about the Kardashians. Number 8, please understand that silence, that's okay too. Sometimes just sharing some silence together is good. And the patient is just happy to have you there. You don't have to fill up every minute of conversation with words. just being there says a whole lot. And admit when you don't have answers. Don't use platitudes or bold allegations that aren't based on fact to hide what may be ignorance. There's a lot that even the medical community doesn't know about chronic pain. There's no harm in saying, I don't know. And then offering to find something out for your patient. So, here we've gone and run long again. But I guess that's because I've been in pain the whole time. But hopefully this helps you understand us a lot better than you did before. My next video will be just a little touch on what not to say to a chronic pain patient. But hopefully this flare will let up soon. And if it doesn't, I'll try my best to keep up a little better. But either way, until next time, my friends, this is the Spoon Bunny signing off. May your spoons be plenty and your troubles be few. Have a great day.